Good day. I'm Christian Joey L. Juan, here to present our study entitled Comparison of Proximal Femoral Nail and Hemiarthroplasty in the Treatment of Intertrochanteric Fractures in the Elderly. Treatment methods for the reduction of intertrochanteric fractures include dynamic hip screw, proximal femoral nail, unipolar and bipolar hemiarthroplasty. Despite many operative techniques, no one method of treatment has gained universal acceptance for these types of fractures. Although the primary treatment of choice for most cases is intramedullary fixation, hemiarthroplasty remains a reliable treatment option for selected cases. Therefore, this study was done to compare the outcomes of intertrochanteric fractures using proximal femoral nail and bipolar hemiarthroplasty in elderly patients. This is a retrospective study done at Veterans Memorial Medical Center in Quezon City, Philippines. Patients with intertrochanteric fractures treated surgically between June 2015 and December 2018 were included in the study. Other inclusion criteria were male and female patients 65 years old and above. This study excluded patients with bilateral and open fractures, fractures in polytrauma, infection, pathologic fractures, and metabolic bone disease. History and physical examination were done, radiographs were obtained on admission and on follow-ups. Data collection included patient demographics, fracture types classified according to the OTA classification, surgical management, as well as duration of surgery and blood loss. All surgeries were performed by the same group of orthopedic surgeons. Patients under the first group were treated with proximal femoral nail. Partial weight bearing was started at 3 weeks with full weight bearing at 6 weeks. Patients under the second group were treated with cemented bipolar hemiarthroplasty. These patients were allowed immediate weight bearing on the first post-operative day. Post-operative complications were qualified as implant-related problems, secondary fractures, infection, dislocation, non-union, as well as systemic complications. Functional outcome scores using the modified Harris hip score was recorded at 2 weeks, 6 months, and 1 year follow-up. Statistical evaluation was done. 75 male and female patients were included in the study. 38 patients underwent PFN, and 37 were treated with hemiarthroplasty. The average age was 76.8 years. There was no significant difference between the two groups in terms of demographic data and fracture classification. In terms of operative times recorded in minutes and blood loss in milliliters, there was significantly higher results in the hemiarthroplasty group. In terms of post-operative complications, none of the differences between the two groups was statistically significant in the following parameters. All cases of wound infection resolved with antibiotic therapy. One case of femoral head screw cutout occurred in the PFN group, which required reoperation. There was no incidence of dislocation in the hemiarthroplasty group. No secondary fractures were reported in both groups. 1-year mortality rate was significantly higher in the hemiarthroplasty group, with 5 out of the 37 patients. The hemiarthroplasty group had better functional outcome scores at 2 weeks post-op compared to PFN, but both groups were comparable after 6 months and 1 year, showing good scores in both interval periods. There was no significant difference between the groups in terms of overall functional outcomes. Functional outcome scores for both PFN and hemiarthroplasty were satisfactory in 1 year of follow-up. Both treatments are equally effective in treating intertrochanteric fractures in the elderly. Similar literature reported high reoperation rates for PFN. However, we reported only 1 case of reoperation, which was not significant, at least for our study. Based on the observations made, we concluded that PFN gives more favorable results in terms of duration of surgery, blood loss during surgery, and mortality rates compared to hemiarthroplasty, with no significant differences with regard to post-operative complications between the two groups. Thank you.